As cities and towns look at cost-cutting measures to offset losses from this pandemic, the state of Colorado continues to shell out millions of dollars in taxpayer money for a field hospital that has never been used, not once.
So tonight we are going 360. Hotels, restaurants, local businesses, they're all struggling. But the convention center seems to be buffered from the chaos. Denver 7's Russell Haythorne has a look.
This deck monitors those 6 indicators and 4 triggers.
Inside the state of Colorado's Emergency Ops Center, a wall of huge monitors allows leaders to track COVID numbers in real time.
Each of these dials monitors a key indicator.
This team is ready at a moment's notice if numbers are to spike again this fall.
So this is ventilators. Pretty good today.
When the crisis started last spring, cases did spike. And the state started building an overflow care center in the Colorado Convention Center so that if hospital beds ever reached capacity, COVID patients could recover here. That never happened. Cases declined, and the beds sat empty.
I feel it's like a waste of money. It has never been used.
And what you may not know is the beds are still here.
What I call the state's insurance policy for our healthcare system.
Colorado's Emergency Ops Director, Mike Willis, says it's like having home, auto, or healthcare insurance. You have it and hope you never need it. But it's a backup plan with a huge price tag. The cost to keep the beds here and lease the space is $60,000 a day. That's roughly $1.8 million a month for empty beds.
You're quite right. We have to be good stewards of the taxpayer money. So there's a balancing act.
We're taking this issue 360, and as you might imagine, public opinion is mixed about how much money is being spent on a field hospital that's never been used.
I think that they need to leave it open because there's too many people still not wearing masks.
I say we save money. Why spend the money on leasing the space if it's never been utilized?
Everything says there's probably going to be a surge this winter, indoor, flu, everything like that. It seems to me that a problem foreseen is a problem avoided.
At UC Health, Dr. Michelle Barron explains this winter could be unpredictable.
There is the risk that we will have a number of flu hospitalizations and then COVID surges, and then our hospital capacity will be diminished.
She says it's in our nature to be prepared for the worst. In Colorado,
you have stuff in the back of your car. You have a blanket, you have maybe batteries and a flashlight. Why? What's the chances of you being in a snowstorm and get stuck? Almost zero most of the time, but that one time.
The lessons we've learned in the past 5 months are immense.
Over at the Medical Center of Aurora, Chief Medical Officer Dr. Philip Stahill does not see a scenario where they would ever need the convention center.
We will not be surprised by this virus a second time.
First, he says COVID cases at their 7 hospitals are declining.
Just 2 weeks ago, for the very first time in 6 months, we had 0 COVID patients.
It's now fluctuating between 5 and 10 patients. That's it. And treatment has even lessened the severity of COVID.
We have healed many patients with 1 single unit of convalescent plasma, and they ended up leaving the hospital when they were at the verge of death. So those patients are less sick than they used to be.
Neighboring businesses like the Hotel Teatro and others say the convention center's continued closure is crushing business. They believe the state should loosen COVID restrictions so conventions can return in some form or fashion, even if mask orders and social distancing guidelines are still in place.
We certainly hope we never need it.
The governor says it's a safeguard.
You never want to be in a situation where you run out of hospital beds, and given that there are not any conventions occurring or happening for the end of the year, there's no other need for that space.
And frankly, this is a trigger point.
Back at the Ops Center, Director Willis points out FEMA is footing the bill for about 75% of the convention center costs.
So that helps a lot.
And with COVID numbers spiking slightly recently,
the data is starting to show a little bit of an acceleration. It has our attention.
His belief is better safe than sorry.
Being prepared isn't free. If I were to ever need it, it would have been worth every penny.
Russell Haythorne, Denver 7.
And as part of our 360 reporting,